My name is Caitlin Thompson. I am a certified social worker. I'm very excited to be here tonight, and I thank you for those who are on Zoom and in person who have come. I am going to be presenting on the topic of diabetes burnout. I would like this to be more of like a conversation, just so you all can share your all's experiences with one another. I know there's only one in person, but those in the chat, if you want to, you can ask questions and share your experiences just as you would if you were in person through the chat box. So that's kind of what the feel of the presentation will be. I also have here with me tonight registered dietitian Mikyla, Dr. Montgomery, and licensed clinical worker Sheila Otten, who is closing the doors for us because they're vacuuming out there. So they will be available during the presentation and afterwards for any questions that you all may have. Okay? Alrighty. So what is diabetes burnout? Diabetes burnout is a state of physical or emotional exhaustion caused by the continuous distress of diabetes and the efforts to manage it. This feeling can be temporary or ongoing, and it can lead your child to feel detached or powerless. So if you can think back for me, when your child was first diagnosed with diabetes, can you remember any of those feelings that you felt? Yeah, sure. And then we'll look at the chat as well.
Oh, okay. Yeah, my son was diagnosed when he was 16, which was only 2 years ago. We actually self-diagnosed ourselves because we have no diabetes in our family, but we went to Google and typed in his symptoms. We're like, wow. Didn't know anything about it. Jaw hit the ground when they said, you're leaving for the hospital now. So I would say scared and just not knowing what this was.
Fear of the unknown. Right. Sometimes parents feel frustrated, guilty, and all of those feelings are perfectly valid. And I'm sure you still feel some of those feelings today. But as you and your child have lived with it, and over the years, you've kind of made it into your lifestyle. It's just your everyday life, managing it. And I'm sure as your son got older, he also became more aware of, wow, this is something that I'm going to have to live with for the rest of my life and manage, which can be very daunting and kind of cause.
Comment from the chat that April Pearson says she felt completely overwhelmed and guilty that this was happening to her child.
Right. Yeah.
If I could jump in, I do think guilt is common because that parents don't know that it's even a possibility of having type 1, because I feel like I'm kind of in the majority. I would have no idea. I mean, that wouldn't even be on my radar. And then, and also too guilty if it does run in the family or even if they have it at all. So I think we deal with that a lot on new onset appointments in the clinic.
Right. And as you all have these feelings, your children have these feelings, which can lead to the symptoms of diabetes burnout as they grow older. So symptoms of diabetes burnout, often children and teens can feel disengaged from self-care tasks. They may skip insulin doses, not monitor their blood glucose, not check it before meals like they should. They may be kind of snacking and not dosing, just not as paying close attention as maybe they once were. Like I said, unhealthy or uncontrolled eating, and also not wanting to go to clinic appointments. Now that one I think goes both ways, because I don't like to go to the doctor. A lot of kids don't like to go to the doctor. But if you kind of see in your child that it's worse than usual, it's kind of like pulling teeth to get them to go, then that may be a red flag that kind of something more is going on.
I think too, it's important to note, and Emily, you could probably talk about this too, that I know we try really hard in the clinic, the medical providers, especially, and the diabetes educators, to not have the child feel or the patient feel judged or criticized or kind of just reprimanded for not doing a good job. But sometimes I think our help and support can come off as being that way, and obviously that's the last thing we want to do.
Lori, has your son ever struggled with going to appointments or anything like that?
No.
No? Well, that's
I have to
good.
say, Eric is very good
Good.
with his dosing and his bolusing because he was older when he was, I guess, diagnosed. He really has taken it on his own. But I mean, I think his A1C was like 6.2 last visit and everything. So I'm kind of waiting to see if that comes down the road. But so far he's done pretty good
Wonderful.
with it. But yeah, I'm afraid he's going to hit a wall at some point.
Right. And that's possible. Has anyone in the chat, I don't know if anyone had said anything, if their children have had any, children or teens, any symptoms like these or anything that I missed? Maybe something else that has come up.
I will watch the chat and chime in.
Okay. Sounds good.
I think one of the things that Sheila mentioned that I'd like to hit on a little bit is I try to be very forthcoming about, like, when we look at data, this is not a reflection of who you are as a person. This is not a reflection of you. This is not like, we're not judging you. There's no criticalness. This is me looking at data so that I can provide the best guidance to help you what you're already doing. And I've learned from Sheila asking, what are the things that you do well, finding where they're at and figuring out ways to navigate. How can we take one step? If we're checking our blood sugars at dinner or at school at lunch, like, okay, what's one more time we can do it every day? Or like finding reasonable goals that are manageable that we can do while we try to kind of deal with the burnout that comes with diabetes.
Right. Because we don't want them to be completely overwhelmed. Let's just see, taking one or two steps, see how that goes, and then maybe we can add on more.
I also think the reality is they're going to deal with burnout again, probably numerous times. And I tell parents and patients that, and kind of our goal is to give you strategies to use when you start noticing those symptoms again, and kind of what works. It's not a shameful thing, but just like, oh, okay, I see myself like not dosing or putting it off. I need to pay attention to that and, reach out for support or do whatever is helpful.
Depression and anxiety can also be symptoms of burnout. The definition of depression is an emotional, physical, and cognitive state that is intense, long-lasting, and has negative effects on a person's day-to-day life. Your child or teen may experience feelings of sadness, frustration, irritability, anger, hopelessness, and then that can lead to the poor self-management of their diabetes. I wanted to take some time to focus on anger and kind of the relationship between depression and anger. You may have once had, when your child was first diagnosed, they were very willing to comply with the regimen and just kind of on top of everything. And as they grow older, they may become more rebellious and they may not want to do the things that they were once doing. And this can come out in anger towards you as a caregiver and as a parent. And when that happens, it can be hard not to be, upset with them. And we don't want to dismiss this behavior, but we want to try to learn, where is this coming from and what can we do to make this better.
That's what I try to encourage parents to be curious. There's that, I don't, for those of you who've seen Ted Lasso, I love that episode about the Walt Whitman quote about be curious, not judgmental. And I think it's easy, especially in those adolescent years, to be like, come on. But I think to get curious about, where is this coming from? What are you angry about? How can I help in this? Is there anything I can do? How can I best support you in this? Not that that's easy to do, especially when you're in the middle of it. But I think seeing the problem separate from the child, your child, and how you both can work on it together. But I think anger, Caitlin, I think that's a great point, because that's what usually gets people in that circular pattern of coping.
Right.
Yes.
Anxiety can also be a symptom of burnout. The definition of anxiety is a disorder indicated by frequent, intense, and excessive worry affecting daily functioning and causing significant distress. So this can be feelings of nervousness, anxiousness, or being on edge, and your child may feel like they cannot control these feelings. Anxiety and panic attacks also share similar symptoms to hypoglycemia. So the sweating, increased heart rate, shaking, and nausea. Children and teens with diabetes, they're constantly juggling, their diet, checking their glucose. There's many things that they have to juggle every day, which can be very anxiety provoking and stressful. And then when our bodies are in this state of kind of fight or flight, we're giving off hormones such as adrenaline, which can then kind of throw our blood sugars off. So we're kind of walking this fine line where we're having anxiety kind of about our diabetes and the stress of that. And then sometimes the stress can also cause problems with our diabetes. And not only do children and teens have stress day to day, worrying about their blood glucose getting too high or too low, but also the stresses of the future and future complications from their diabetes. Kind of after describing anxiety and depression, has anyone seen any of these symptoms in their children? Either on the chat or Miss Lori?
I don't think so.
Not yet?
I mean,
Or
he had an injury last year
Mhm.
To his knee that put him down, and he just said, "Mom, I've had it.
Yeah.
I've had it." And so we called, and I thought, "Look, we got to get him in." And he has no problem going to see you, Sheila, or to see in therapy.
Great.
We've always encouraged it and been very open about it.
Mhm.
So, and it is, I just kind of talk to him, "How are you doing?" That sort of thing. "How are you feeling?" And I try to understand diabetes because it's not something I understand myself. So I try to ask him about it, what are your feelings, and let me know what you're going through.
Right. And were there any feelings that came up in you in that situation?
Not that I can recall. It's just wanting to help.
Right.
I know what the resources are, so I'm reaching out. I'll go to my chart. I think I recognize your name. So I've got through my chart. I ask questions and that sort of thing. So having a good support system.
Yeah, of course.
I think a thing to point out that sometimes I think gets lost is about the, parents experience those feelings too, and also the anger. And a lot of times behind anger is fear, because parents feel an enormous responsibility in caring for their kids and also keeping them safe and keeping them healthy and alive. And so sometimes when that we're afraid of that, and if diabetes burnout comes up and they're not managing it appropriately, they're really scared. Parents are scared. Like, you've got to take care of yourself, and this is serious. I can't tell you how many times I hear that from parents, but sometimes that gets lost in that they're just really scared for their child too. And I think also communicating that to your child can be helpful. Like, look, this really scares me. I'm afraid, especially when they go off to college or get into high school. It kicks it up to a whole nother level.
I got a couple of comments in the chat. One comment said, "My son sees a therapist and it has really helped him with all the stress, anger, and frustration that he feels with diabetes.
Great.
He's 11 and has had it for 2 years." And then another comment, "I think my son has experienced all of these symptoms at one time or another, thankfully with supportive providers and a therapist who specializes in children with chronic illnesses and has T1D themselves has been so helpful."
Right.
Good.
Yeah.
And I think children speaking to people that aren't their parents or their siblings or their family members is helpful. Someone that has that outside look and, doesn't know these other people and is kind of no judgment. I think that that's very helpful as well.
And I think from our end as providers, remembering that being a teenager is really hard in itself without having any kind of other things. And when you add diabetes to that, that really complicates life to another level. And trying to kind of figure out how to fit that back in, how to be a teenager and like tolerate that and cope with being a teenager, and then how to fit diabetes into your life that doesn't make you feel different, because different is like the last thing you want to be when you're a teenager, right? It's already about fitting in. And so, you know, finding ways for us to help them navigate figuring out how to, you know, have diabetes but not be all about diabetes, and just kind of manage that within their life of being a teenager, and leaning on both of these guys to help navigate through that.
Also, too, I think finding a way to rebel that doesn't impact your health, ideally, and just recognizing that that's what teens are supposed to do. They're supposed to push. They're supposed to stretch. They're supposed to kind of extend themselves and be like, oh, wait a minute, and then back up again. But just finding the other ways to do that doesn't impact their health is important too.
We do that with food a lot. If you're
Oh, yeah.
worried about the veggies that they need to be eating or getting so much of a certain nutrient, that can be even more work and effort and pressure on top of trying to manage just how many carbs, and are we matching that to your insulin? So giving up some of those small battles with what food you're eating, or what what snack did you have while you were at school, and just eat what you eat, count the carbs, and we'll worry about the rest, as you grow in age.
Right. I like the giving up some of the battles.
Yeah.
I think that is a really good point, because kids may feel like we're just picking at them, but maybe we should just kind of, take the wins as a win and kind of just continue on. And this kind of gets into my next topic.
Another comment is, I think just being a teenager and being different at school is hard.
Right.
It doesn't help when you're beeping and having lows or highs. It's just hard for them.
It is.
And like I said, this kind of relates to this slide. So why it's so difficult in teens, they're going through different developmental changes, emotional changes. All they want to do is fit in and be like their peers. They want to be spontaneous. They want to be able to go get ice cream, eat what they want, do what they want without having to worry about, the chores of diabetes. And also being in control. Sometimes their blood sugars are, really high at one point or really low, and they're doing all the things that they need to do, and it's still not where it needs to be, which can be very frustrating. Expectations for diabetes task. So as your children get older, they become adolescents and teens, you can kind of work with them to see what task and responsibilities they can start to take on their own. Now, it's kind of, you all have to kind of figure out what works for you. So if we give them too many tasks and too much responsibility, then they can kind of feel like that they have failed. But if we don't give them enough, then they can feel like, oh, I'm being babied by my parents and I can do more. So your kid better than anyone else. So just trying to figure out what works best for them.
And then we do something where when kids are at the point where they can manage all the responsibility and they've taken on that total independence, sometimes they still burn out, even when they're doing it really well, which is like a lot to do any of it, but to do all of it and to do it well is like incredibly stressful, right? Like that's such a big burden on your brain. And sometimes they just want to have a little bit of freedom from having all that responsibility. And we do what we call like our diabetes holidays, where they tell their parents, like, all right, for this weekend, I just don't want to think about diabetes. I want you to make all the diabetes decisions. I want you to do all of it, and I don't want to do any of it. And they agree, and like that's their break. Like obviously they still have to get insulin, but like somebody else is doing all the thinking, all the mental math, all the mental gymnastics. Somebody's taken that load off for a period of time. And sometimes it's not a long-term solution, but it can be really helpful for a break.
Yeah, just that little bit of relief.
I also think getting a diabetes diagnosis kind of requires you to be fluid, to ride with it. And sometimes, again, diabetes burnout, that rigidity can lead to that they have to do it exactly like this. And if they don't, like if they eat and then they don't dose, or then they failed, and then it gets, dovetails into why it's just too much and why even bother when, like I said, diabetes teaches you, to be ride the waves and, okay, so you didn't dose before one time. It's okay. We don't want to do that all the time, but one time isn't going to, that old saying about throwing the baby out with the bathwater. We don't have to stop everything just because there was one oversight.
Kind of molding it to your lifestyle. Teens like to stay up. They like to eat late at night or early in the morning, you know, so just trying to figure out how they can still do those things without it, you know, causing a fight or affecting them.
Well, one term I don't like is like they're sneaking food. And it's like they're not sneaking food, they're just not dosing for it. It's, you know, they're allowed to eat. They just need to dose for it. So.
And then how to take care of your child emotionally during this time. So as parents, we want to, you know, we don't want our children to be in pain. We want to fix it. And sometimes, you know, it's okay to say, you know, diabetes sucks. And that's okay, but how can we make it suck less? So it's okay for them to be upset, to be annoyed, and to be frustrated. I think calling out the good things that we do or that they do, kind of like you all were saying, kind of helps them reframe their minds into a more positivity and allows them to be more confident. Sometimes I think we just try to focus on the negative. That's just kind of how our brains are wired, but trying to focus on the positive and letting our children know that we're proud of them and they're doing the right things. Terminology is also important. The words good and bad, I think, hold a lot of emotion. And I like to look at blood glucose levels as just kind of bits of information. They tell us when we need more insulin or more food. And it's not something that's, you know, good and bad, because when they kind of carry those words, our children can be more fearful to share those numbers with us, or they may, you know, fib about them and things like that. And we want there to be an open conversation. So that may kind of take away the intensity of the blood sugars, and you all can freely discuss them without worrying about, you know, it becoming more than just a conversation.
Yeah, I think that's a really good point. It's something that we strive to, I think I have learned over time, especially from Sheila and some of our crew, is that being very upfront, like numbers are pieces of information, just like you said. And this tells me that you need insulin or you need carbs or you need something. It doesn't reflect on who you are as a person, because good and bad are such indicators of like, I'm a good person, I'm a bad person, I'm doing a good job. Like there's no grades in diabetes, right? Like we just do the best we can with the information that we have. And like information is just data that we use to make decisions, and not labeling it, I think is really helpful and really important. And something we don't realize, I think, when we don't have diabetes, when you're not on the receiving end of that kind of talk, you think like, okay, yeah, that makes sense. Like, you know, low is dangerous, low is bad, danger. But then when you hear it and you see like, okay, I see like the connotations here are pretty strong. If I were receiving this kind of language, I would probably have a lot of different feelings. So,
Right.
Yeah, I think that's really important.
Kind of putting yourself in their shoes. Right. And then lastly, as parents, as caregivers, we kind of have to remember that we're all in this together. We all have the same goal for our children to be the happiest and healthiest that they can be, and they deserve to feel that way. And we also have to remember that as parents, you all also deserve to be happy and healthy and not take on the burden of your child's diabetes diagnosis. So kind of just as you make sure that your child has all the support they need, ensuring that you have the support that you need so you can successfully care for your child as well.
And just to piggyback on what Emily said about the good and the bad, I think that's important to do that with parents too. That, oh, they had good blood sugar, so I'm doing a good job, or, oh, they went low this morning, I'm doing a horrible job, or stuff like that. And the same thing, exactly like what Emily said, it's not good or bad, it just is. And I like to say, like the Dexcom, especially with new parents, it's just like GPS telling you where you need to go. It's not a confirmation you're doing a good job or a condemnation that you're not. It just is telling you what you need to do next. So I think that's a really good point.
So does anyone have any questions on the chat, or Miss Lori, do you have anything or any comments in general?
Well, one thing you had mentioned is you had mentioned like future complications. I mean, I know there's future complications possibly with your eyesight, maybe with your feet. I don't know too much about that. I have not said anything to my son about it. I don't know if he knows, and I don't want to mention it to him, to be honest.
Right.
I think that's one.
I mean, is that a good idea? Because I don't want to be like, this is a doom and gloom. And I don't think anybody has said that to him, that it's doom and gloom, because we don't really know anything about it. So do you really present that information to him, or just say, hey, you're doing a great job, keep going?
Just say, hey, you're doing a great job, keep going. The adult doctors will bring that into play later on.
As long as his A1C stays under 7, he's probably not going to have that conversation.
Yes, but he will know about it later. But right now, we need to go.
But I think there are two schools of thought on that not mentioning it, and also too, some people think that, not that you need to scare them with that information, but they try to get them to take it seriously. And I think research and experience has really shown that's not really helpful. Because they pretty much know, like, and I know when I see patients, I always ask, do you understand what type 1 is, and do you understand, some of the things that could happen with continuous high blood sugar? And he's like, I've already been scared about, or threatened with that. And I'm like, whoa, I'm not here to, I just want to make sure you understand what can happen. But I think that's a really good point, though, too, because you don't want them to be like, oh my gosh. Plus, with adolescent minds, it's not going to happen to them because they're going to live forever and everything's going to be fine. So,
Yeah.
yeah.
Well, if no one has anything else, again, I thank you all for coming in person and on chat, and have a wonderful night.
Thank you.
You're welcome. Thank you.
The chat says thank you.
Oh, good.
Aw.
Yay.